Hi, I'm Cynthia Geocaris from Surgical Associates of Neenah in Neenah, Wisconsin, and I'm honored to kick off the session on community practice with my talk titled Community Practice for the Uninitiated. So why am I here today? I am a community surgeon. I'm from a small town. Probably most of you haven't heard about me, but I'm here to tell you my story, talk about my successes, my failures, my loss, how I struggled, and then what I gained from it today. Why are you all here? Hopefully I'll be able to give you some tools to move through the struggles of leaving your residency and entering into practice, talk to you a little bit about success as a surgeon and even as a female surgeon for any of you women out there in the audience today. I'll teach you how to be an educator even if you're not in academics and you are entering the world of private practice, how to really make an impact on patient care, and how to not lose yourself once you're entering into the community. A little bit about me. I trained at Loyola University of Chicago in Maywood, Illinois. Way back in 1991, I started medical school. I did my residency at University of Wisconsin in Madison. I'm board certified. I've had 3 jobs, and I currently work at Surgical Associates of Neenah in Neenah, Wisconsin. My disclosures: I am a paid consultant for Intuitive Surgical for their educational programs. I've run a mentor site teaching program for hernia surgery and robotics and continue to proctor and teach robotic surgeons across the country. So starting out, I joined my father in practice in 2000 at Surgery Specialists of Green Bay. I arrived with 2 small boys. My oldest was 2 and my second child was a newborn, and we grew our family to 4. We operated together in the operating room, and I was fortunate enough to have a family business where my mother was the office manager, my brother was our surgical assistant. My passion is robotic surgery, and my father and I started a robotic surgery program way back in 2005, and we're some of the early adopters of robotic surgery in the country. So these are some of the things I learned from my father. He was a great mentor to me. He was an old school surgeon that did his residency at County Hospital in Illinois. But his advice was simple, and it stuck with me for a 20-year career, and hopefully you can remember these small things and use them yourself. Don't get mad about the small stuff. In a hospital, you're going to get mad all day if you worry about little things. Treat your patients like your family. If you do that, people will continuously come back to you. Treat them how you would want your mom, your sister, or any of your loved ones treated. And finally, don't wear scrubs to work. I was privileged enough to be sent home from work one day by my own father. After a long night of call and being up all night with a new baby, I arrived to work with a little bit wet hair and my scrubs on. My father said, "What are you doing?" I said, "I'm coming to the office." He said, "Get back in your car and go home. You don't come to work like that. Get yourself together, put some clothes on, show up for your patients." So I've done that. It stuck with me. I present myself well. I show up like a professional surgeon, like my patients want to see me. He taught me values of mentorship, education, collegiality, leadership, family, and fun. He taught me to always scrub cases together. When you are a new surgeon, you come out thinking like you know it all and you have new things that you want to show everybody. But sometimes things go wrong, and not everybody in your community is going to be as excited as you are for that new surgeon to be in town. I was that first female surgeon in Green Bay, Wisconsin. I remember my first laparoscopic appendectomy on a child. Well, they didn't do that back in 2000. That prompted a special peer review to talk about why that case was done and should she really be doing that. But it helped me. I scrubbed with my father on the majority of my larger cases. He taught me how to make friends with my colleagues and my competitors. I learned a lot from them, and they learned a lot from me in return. Present difficult cases and discuss them with your partners or even your primary care physicians. Um, Talk to them about what you're doing. Again, be friends with your competitors and then learn a little bit about the business. If you are going to go in private practice, you owe it to yourself to learn what you're getting into. That's something we're not often taught in medical school and probably not taught in residency. He taught me the value of education. Again, I'm going to emphasize the value of assisting. That's more and more difficult with the rise of minimally invasive surgery and even robotic surgery, which I do most of now. But assisting others is extremely valuable. You get to learn new tricks that other people do that you might not have picked up. And you get to get some comfort into your own practice. Attend hospital conferences and CME events. Keep up to date of what's going on in your field. Collegiality. This is probably one of the most important slides that you will hear me speak about. I've said it before and I will say it again. Find friends in your colleagues. Be friends with your competitors. This is part of medicine that is lost today. We're worried about market share. We're worried about money. Your CEO is going to want you to be more and more productive, but your competitors are your allies. They're your friends, and we need to do more to work together. This meeting is a great example of that, but you need to do it in your own community. Our job is to be there for our patients and to elevate the level of care for all of the patients in our communities, even if one of our competitors is taking care of them. Reserve judgment. You're going to see a lot of people have complications. You're going to get patients come to you who had a complication elsewhere. Again, reserve judgment. That'll probably happen to you one day. You weren't there. You didn't see the situation. Be sympathetic to it. Be empathetic to it. When people are referring you patients, say yes. Ask them questions later. No primary care physician wants to be grilled over the phone as to why they're sending you a patient. They need help. Even if you're not going to be operating on them, they need your opinion and they need your advice. Remember these things when you go out into private practice. It's not the academic world anymore. Be a leader. Get involved with the hospital and its committees. Be involved so you know what's going on. Earn the CEO and the administrator's respect. Join your surgical societies like this one that you're here today. There's many of them out there. Who knows? They may ask you to speak at one day. Get involved in teaching and consulting. Throughout my career, I've had the privilege of teaching medical students, residents, PA students, nursing students, surgical tech students, and even other surgeons. Through consulting work, I've proctored surgeons in robotic surgery and even had them come and watch me do surgery. This was an unexpected and very rewarding part of my career. I never thought I'd be teaching. I went into private practice. It's been one of the most rewarding things that I do. Get involved with charity and community service. Bring your world to the community. These are a couple of pictures of events that I did this year. One of them behind the bar there is a celebrity bartending event. I'm not sure if I'm really a celebrity, but me and a couple of plastic surgeons did a event for breast cancer awareness, and we tended bar, and all of the tips went to charity. It was actually fun, and I got to talk with the plastic surgeons in my area. Some of my competitors participated in this, oncologists and radiation oncologists, and it was a great community bonding event. The second picture is me attending a yoga class and talking about the importance of screening mammograms. The yoga class was dominated by young women in their 20s, but surprisingly, they had a lot of questions for me about themselves and about their family. It was really fun to get out there and just ask what these people were interested in and give them my knowledge. I've had a lot of success that was built on the foundation of my first job with my father. I was a leader in robotic surgery in Wisconsin. I was chief of surgery many years. I was medical director of multiple service lines, and really involved in the hospital. I was a busy surgeon, a great family, and I really had it all. But there were also struggles along the way. This is the hard part of the talk today. This is the part nobody really tells you about. You're going off into your new life, into your new job, and everything's going to be great. But it wasn't always that way. There was competition. I came into my first job in 2000, and I knew things that other people didn't. I was a female. I knew how to do laparoscopic surgery. I knew how to do bariatric surgery, and I knew how to do sentinel lymph node biopsy. That was pretty cool, and it helped me to really build my practice. My competition didn't like it very much. They weren't always behind me, and they didn't always support me. I was asked to talk a little bit about academic snobbery. I didn't experience this too much in my practice, but I know many of my colleagues that have. What I can tell you and how I have gotten through that is really maintained a relationship with my training program. I happen to work in the state that I did my residency. I continue to be friends with the attendings at University of Wisconsin-Madison, and I have developed a two-way street of referrals of patients. It's not unusual that Dr. Weber will call me and send a patient to me, which doesn't always happen in the community that your university sends you a patient. So keep your relationships going. Be friends with your training institution. You're going to battle corporate medicine when you go out into private practice. The CEO of your hospital will not always have the same agenda as you do. It's going to be hard. You're going to bang your head against the wall a little bit. You're going to want to do better for your patients, but the hospital may not have the dollars to do that. I'm living that right now and trying to develop a robotic surgery program and put new robots in the hospitals, but we just went through COVID-19 and the capital dollars aren't there. These things are real and these things will happen, and you'll have to learn to work your way through them. It's not always easy. Probably the hardest part of my career happened with the illness and death of my father. My father and I worked together for 10 years. We had a great family business. And 3 months after his retirement, he was diagnosed with locally advanced pancreatic cancer. He subsequently started on FOLFIRINOX chemotherapy. He was able to do that for about 14 months and died. During that time, the hospital was changing their business model and used that opportunity to move into an employment model with my practice. I took it really personally. I don't think it was a personal attack on me. I think it was a business decision that coincided with bad timing. But I ultimately lost the family business that was my father's legacy due to this change. This was probably the hardest part of my career and the ultimate low. I felt betrayed. I felt stabbed in the back. In hindsight, it really wasn't that. But it was difficult for me and difficult on my career. So this led to choosing a new job, and I wrote choosing the wrong job, even though I had a lot of success and worked at a very great hospital. I made my decision to move to a new place because I was angry about the business decision of the hospital, and I chose money over my values that I had originally been taught. My partners had different patient care philosophies. I lost all of my work-life balance, and I began to lose myself. Despite that, I had a lot of success. I was on the board of directors. I was on the medical executive committee. I was doing 16,000 RVUs a year. It was pretty good. I made a lot of money. I started a robotic mentorship program and was a leader in robotic surgery. I was having a great time doing what I love to do. Despite that, I was on call 3 out of 4 weekends a month, many months of the year. I was exhausted. I no longer had any family time. I really didn't have a relationship with my partners, and we did not have collegiality in our practice. Remember your values. If you didn't notice, I switched the order. I learned that family and fun were maybe a little bit more important than my career. So that leads me to new possibilities. I found my new place. I work in a practice where I've known most of my partners through medical school and training. We've all trained at the same medical school and residency, and we all have the same values. We all have a passion for robotic surgery, and we're bringing that into a small community and across a healthcare system. Subsequently, I'm speaking at a national meeting working in a small town of 30,000 people. I develop service lines. I'm really good at that, and I'm very proud to be developing a robotic surgery program through Theta Clark Health System. I started a website. I write a blog. I consult with other surgeons, not only in teaching them robotic surgery, but helping them navigate through community practice, how to deal with administrators, and how to deal with the challenges of running your own business. So what's my advice to you? Learn some of the business. Know what you're getting into. There's many types of community practice where you either own your own business, you're employed, and many other models. Take some time to learn about it, whether that's through a national meeting and some classes, or reading about it on your own, or getting advice from some of your older colleagues. Know the playing field. Are there going to be multiple groups competing for the same business in your market? Just know what your situation is before you get into it. And you're going to have to accept some bullshit, unfortunately. Some of it's going to be hard. Trust yourself. Enjoy your patients. Spend time with them. Get to know them. And number one, always have time for your family. Nurture your passions. Take care of yourself. Get support if you need it. I myself have had to turn to a life coach at times in my career. I'm getting emotional even talking about it. Take time for yourself. Finally, when you get lost, stop. Remember why you started. Thank you all, and good luck to you.